It's now virtually impossible to pick up a newspaper or to listen to a news bulletin without hearing of a further crisis in the health service. Last week we had the story of the failures of the X-ray services in the North East. Last Monday night there was a Primetime Investigates programme which showed the dilapidation of our health service, showed the case, for example, of an elderly woman trying to cope with caring for her stroke victim husband without a home help, medical experts warning of a diabetes epidemic, and the continuing trend towards the privatisation of the health service. Today we learn that Our Lady's Hospital for Children in Crumlin, that 100 jobs are to be cut in that hospital. These are 100, I understand, mainly agency and temporary workers that have been taken on by the hospital because of the recruitment embargo, that they couldn't recruit people in the normal way. And we're told by way of a circular yesterday from the hospital that because the HSE has given the hospital 14 million less this year than the hospital's projected expenditure, that 100 staff are going to be removed from that hospital. Now, you can't take 100 staff out of a hospital without affecting patient services. So what this is going to result in, inevitably, is that sick children will not get the treatment that they need in that hospital. It will mean that parents of sick children will be told that their sick child will have to wait because the services that the hospital should be providing are not being provided. Now, all of this goes back again and again. All of these crises in the health service come back again and again to the failure of the HSE to manage the health service properly. This was the instrument that was established by the government to run the health services. So I have two questions for the Taoiseach. First of all, what is going to be done to ensure that Crumlin Hospital will have the staff that it requires in order to treat the sick children that present for treatment there? And to assure this House, and I've said this before, that in different economic circumstances, when cuts are being made in expenditure, that they will not be made in areas which affect the most vulnerable. And among the most vulnerable are children who are ill and who need treatment. And secondly, to ask the Taoiseach if he will take up the proposals which were made and published last week by the Labour Party, proposals developed by our health spokesperson, Deputy Jan O'Sullivan, for the reform of the health service and the reform of the HSE in particular. Because it is manifestly clear now that the HSE is not managing and running the health service to deliver the quality of care that is required by the people of this country. Cancorla, if you take 100 people who are working in a hospital out of it, you're going to affect the service that that hospital provides. And when a parent shows up in Crumlin Hospital with a sick child, they won't want to hear about service planning and about budgetary discipline and about this many million last year and that many million another year and which administration introduced what legislation or whatever. They'll want to get their child attended to and cared for. And if there are 100 staff less in the hospital, it means that they are less likely to get their child attended to, or they'll be told to go away and to wait. Now, your job, Taoiseach, and your government's job, and the job of the HSE that you set up, that your government set up to run the health service right, is to get this fixed and to get it sorted out, and to get the issues of service planning and budgetary discipline and all of the rest of it sorted out, because the patients, the people who are suffering at the receiving end of a health service that's not working, don't want to hear these excuses. They want to get better. They want to get cured. They want to get the services that they need in the hospitals. And the problem here is that the body that you set up, your government set up, to run the health service is not doing it efficiently. Now, the Labour Party published last week a set of proposals which we put forward as to the reforms that are required in the HSE in order to put this right, among which was, for example, a proposal that a voluntary scheme be introduced to take out of the Health Service Executive the overlapping layers of management and administration and bureaucracy which seem to be getting in the way and seems to be eating up budgets that should be used to provide the staff that are required at the front line in the hospitals, in the health centres, in order to deliver the service to the people. So I think we're long gone past the stage of having arguments about, this budgetary discipline and service planning and all of this gobbledygook, which is gobbledygook to the patient. It's gobbledygook to a parent who's coming in with a sick child to a hospital who's being told that they can't get the service. Now, what I'm saying to you, Taoiseach, is get it sorted out, reform the Health Service Executive, and let us not end up in a situation where week in, week out, we have this hospital or that hospital or one service or another which is not functioning. It's long past time that you sorted out the mess in the health service, reformed the Health Service Executive and provided the care to patients that we as taxpayers are paying for.